along the way. Good morning, everyone, dear panelists, and thank you for hosting this event. Thank you for joining us in the hosting of this event. We shall be talking today about partnership for effective implementation of the international drug commitments. To start with is to give us a brief about synopsis of GHI, and this is what we hope to cover in this event. This is the president of GHI's speech. Briefly, to introduce the Green Crescent Air Development Initiative, it was started on the 7th of December 2016, and since then it has been active in the field of prevention of nicotine, alcohol, and other drug of addiction, and process addiction as well. Those are the digital addictions, and other behavioral addiction. It has carried out since its inception annual addiction prevention workshop nationally in Nigeria since 2017. And it has participated in annual addiction prevention advocacy at the CND since 2019. And it has collaborated widely, locally, nationally, intercontinental, and internationally with various partners to achieve its goals of reducing the harms from all drug of abuse and process addiction. And to this, we are opening this one of the things that's kickstart and lays the foundation to the why this event is taking place. And on this, we want to talk briefly about what this event entails. The theme of the event emphasizes the critical role of what collaboration means, the innovative way that is being done, and the evidence approach that supported this. And this is hinged on the United Nations Office on Drugs and Crimes endorsement of globally recognized models that underscores the necessity of adopting strategies that meet the unique needs of local, national, and international population for successful outcomes. These sessions aim to foster a unified commitment among stakeholders towards achieving sustainable developmental goal. 3, which reflect the indispensable value of partnership in advancing international drug policy efforts. This event will look into global collaboration, showcasing as a transformative strategy that focused on the use of prevention in the global community and positioning it as a template for broader and further engagement. Our moderator for this event, who is the president of the Green Crescent Pharmacist, Dr. Mohammed Audi, he has some technical challenge, but he will join us along the line. And the other presenters will be Zeynep, which is from the Turkish Green Crescent Society, Giovanna Campello from the UNODC Prevention, Treatment, and Rehabilitation Section, and Matej from UTRIP. I am Tajuddin Abdullah. I will be presenting our view about the Green Crescent Development Initiative in terms of partnership. On this, all of us are welcome. We know this session lasts 15 minutes, so each presenter will be kindly asked to adhere to time, which is just 10 minutes per presentation, which will be followed by question and answer. And our gratitude to all for joining and finding it useful and early to participate in this event. From here, I shall be moving on to the next presentation.
Can you hear me?
Yes.
Hello.
Yes, we can hear you.
Yeah, we can hear you.
Mr. Audi.
Okay, so sorry about the glitches. I was muted and I tried to get the icon for to unmute myself. I couldn't. Thank you so much, Dr. Abiola. With the introductory component taken, I want to first of all apologize for the glitches, and I do hope that we will continue the webinar in no time. Already you have outlined to the presentation proper. As you have been told, it's for 50 minutes, and each presenter is expected to do a presentation of 12 minutes. Once it's 10, we will signal the next presenter. It would signal that you round up, and then the next presenter comes in. Sorry about that. Please, Dr. Abiola, you have the floor. Thank you.
Thank you very much, Mr. President. And it's nice to see that you are able to join and moderate and facilitate the event. Thank you once again, everyone. And I will be talking about partnership in drug policy implementation, strengthening the collaboration for addiction prevention. I'm Tajuddin Abiola. I'm the National Secretary of the Christian Development Initiative in Nigeria. To start with this presentation is to have a brief global look at the world drug problem. And these statistics I'm showing are based on the World Drug Report of 2023, which shows that the prevalence of addiction in West and Central Africa, when you look at the common substance of abuse, which is cannabis, is staggering. It's the highest globally because they are often grown locally. And of course, there are importation from synthetic cannabis that are flooding the market as well. But yes, the West African sub-region and Central Africa, especially Nigeria, which is about 52% of West African population, have the largest portion of the prevalence of cannabis used within the continent. And this is quite staggering compared to the global prevalence of 4.40, that's 10% to 4.4. And when we look at opioids, which include those that are legally manufactured and those that are illegally manufactured, we still have higher prevalence compared to the global population from 1.2 in the West African sub-region to 1.10 globally. And also, our environment is now being noted to be notoriously the influx through transshipment from cocaine seizures, because the cocaine seizures experienced in our environment have shown that the manufacturers of this product are finding our continent, our part of the continent, as a place to not only transship, but also to leave some of the products for consumption, which is causing lot of challenges to the region, especially when we look in terms of the arms, the crime that are related to this event, and how it breaks the law of the land, contributing more to criminal activities in the region. So putting all this together, I've shown that the region that we'll be looking at, the West Africa region, is facing a lot of drug problems. And this is not limited to this area, because once this product, especially cocaine, are transshipped from the West Africa region and they get to the Euro-America region, their price, the price for these hard drugs increase, which also shows the danger it causes. So we hope that if you partner together, you might be able to achieve more in rolling back the arms from this and the rates of this problem. So what are the value and the role expected in terms of getting in terms of the efforts that we put in place to do this? These are some of the foundations to what I'll be discussing today. This is based on the 2030 agenda of the United Nations that set forth the 17 Sustainable Developmental Goals that help us to see that we can forge a better future, not only for few wealthy nations, but for all nations on earth. And looking at this key role, particularly when we look at the SDG 3 and SDG 17, these two goals highlight the crucial link between good health and well-being. And partnership is crucial for these goals to be achieved, both the SDG 3 and SDG 13. Because when all these are put together, the partnership will help to mobilize resources, to share knowledge, and to bolster the achievement of all the SDGs together. And looking at it in terms of drug of abuse, this SDG is very vital in pushing the agenda of reducing arms from addiction, reducing the use, the rate of use of addiction, and ultimately achieving the goal of eradicating drug of abuse globally. Because we know no matter the amount of substance use, it harms the health and it does not promote the well-being of the individual, the family, the community, and the nation and the global community at large. So what are the key reasons for partnership, which have been shown us that there's a need for it, and this has been sorted by the UN document itself. The key reasons for this is that it helps us to pool resources together, and in terms of this, we have been highly beneficiary from getting from the experiences of others from how they are able to raise funds to carry out activities. And this resources from there, this experience, this knowledge from there is very helpful in to see that we're able to carry out activity and collaborate with others. It also helps us to lend our strengths to others, because it helps us to sit on the shoulders of giants. We are a young NGO looking at the time GHI was started, but we can sit on the shoulders of giants like the UNODC, UTRIP, and others that are here, the Green Crescent, Turkish Green Crescent. We're able to sit on their shoulders to be able to learn from them so we can complement our strengths to theirs and be able to achieve more. And this synergy through innovativeness has helped us to see that we are able to sustain our activities year in, year out, and we have recorded success from it. And the scale and the reach we're able to get through, because without this partnership, it will be going to be very limited and will not have achieved much or be able to move the little mile we are able to move. I will hope to reach further with the help of partnership, which is the reasons this partnership are very important and is highly encouraged for others to share in it. And in the process, we're able to share risk and the risk incurred, how to overcome those, and what needs to be done, what resources are needed to overcome this. All these are put together, and this partnership helps to overcome this. And the ability to overcome risks help us to sustain the effort, help us to sustain the energy, help us to sustain the goal of rolling back addiction globally. And based on the effort put together, we're able to build trust and relationship across the continent, and also in the process to influence policies that will help to sustain, to bring about the accomplishments of the SDG Goal 3 and SDG Goal 17. And all this being put together, we're hoping that partnership, which is very vital, will help us to arrive there. And looking at international commitment to partnership, what are the benefits and what are the outcomes that we hope to look at is that when they are carried out effectively, the approach is multifaceted. We're able to get so many inputs from others, and all this helps us to meet not only individual needs, but because the individuals are varied and they are dynamic and they are diverse, it helps us to be able to get to meet their needs by getting from everywhere. And also, it helps us to see that there is shared responsibility, so that it's not a weight put only on one individual, but it's a responsibility that all are able to share together. And in the process, we're able to get more, we're able to improve our strength, we're able to improve our knowledge, to improve through capacity building, and also ongoing innovation and best practices were inculcated because we follow the evidence, we use the researches, and we employ technology to be able to achieve the best from this. And this have helped us to sustain the advocacy and help us to carry out the awareness based on evidence, not just mere noise making, but we're able to bring out awareness based on the evidence that prevention is cost effective, is helpful. And we know in our own environment, it saves more than $10 comparing to the Euro-American goal. In our environment, it saves more than $32 averagely when we compare to that. And the sustainability that we get from this is unparalleled. What do we benefit through successful partnership in drug policy implementation? The GHI has been able to engage both non-profit organizations and the civil society. Through so many of them are endless. I've just to read them about. These are people who are partnered with. These are limited lists, but this is just to put some of them on there. And through this partnership and interaction, we have been able to go I call it the little mile we have gone. But I'm sure without that, we would not have even moved an inch in achieving the goal of why the GHI was created and able to move forward. So to all the people who have partnered with, to all the people who have supported the one way or the other, especially the UNODC, which keep giving us guidance and the document, and we're able to streamline it to meet the specific need, the local needs of our people. I'll be very grateful, and to all who are very grateful. What are the lessons we have learned in this approach? And it has helped us to be able to key in to the specific consideration from all other non-public organizations. And all these have been able to help us to see the key questions that help us to ensure the needs of people locally admit and not just bringing international experience without them meeting the needs of people locally. So through this collaboration, we'll be able to learn from others and we'll be able to implement it, to adapt it, to see that they're locally relevant and help the people to grow. And through that, we'll be able to sign so many memorandum of understanding, so many other joint action plans, and this will be helpful in getting that we succeed in what we are doing. And also that it also helps us to know that there are many types of leader partnership that we need, both formal and informal. And on this, we'll be able to meet up with so many other organizations. And by doing the partnership effectively, it helps us to achieve the goal of what the partnership should be. We have been to formal organizations. We have been able to penetrate informal organizations like the informal education system in Nigeria, for example. We have been able to get there to speak to them, and that helps them to understand from evidence point of view what addiction is, what they need to do, and how they can use through the local understanding of it, what they need to do. So this partnership has helped us to get this done. And it has also opened opportunities for us in order to see, yes, there are challenges that are there, but the challenges are being overcome due to the cooperation, the beneficence of the partners that we have, and this has helped us to achieve a lot with this. Of course, there are many case studies that I could have cited, but because of time factor, I will stop here, and if the time permits, subsequently I will move on. So for me, just to end it that partnership is very vital and is essential in the global world as of now. Without partnership, our efforts in order to tackle the hydra-headed monster called addiction, whether it be drug of abuse or process addiction like digital and behavioral addiction, it will be very difficult for us to be able to get so many experiences across the world, to be able to synthesize this to meet our local needs, to be able to share it with other people locally so that we can be sure we are following what the evidence is, we are doing the needed thing, we are doing the right thing without fear, and be able to see that we are impacting, we are actually carrying out what is evidence prevention so that people can actually, people's needs in order to stay safe, in order to improve their health, in order to improve their well-being are achieved. And this has told us the importance of collaborative efforts, and it has also encouraged us to see that we do more partnership and achieve the goals of addiction prevention.
Yeah.
At this junction,
I think thank you so much. Sorry about I deliberately allow you a few minutes considering the glitches we have at the beginning of the session. It's my pleasure to call in the next panelist to come in. Zeynep. Zeynep, please, can you have the floor now?
Yes, thank you very much.
You have 12 minutes, and when it's 10 minutes, I will give you a signal. You're welcome. Yeah, good morning. Yeah. Yes.
Okay, let's see. I hope you can all properly see my screen now.
Yeah.
Perfect. Thank you very much for the introduction. And again, good morning and good afternoon to everyone. My name is Zeynep Temel, as our moderator also said, and I'm honored today to represent the Turkish Green Crescent Society as an expert of the advocacy department of Green Crescent at the side event. And today I'll be discussing our main topic, which is the partnerships for the effective implementation of international drug commitments. And I think it's an important topic to discuss, especially as we wrap up the CND week this year of the regular session. So this is going to be my table of contents, basically. So to briefly summarize the international drug commitments, as we all know, Broadly speaking, they refer to agreements and conventions established by the United Nations and other international bodies to address the global drug problem. And these commitments provide a framework to all of us for cooperation and action among nations, and of course of civil society and the UN as well. So the civil society being the third UN, so to say, cooperation and action, as I said, among nations and like all global fora, global governance fora, to tackle drug trafficking, drug abuse, and related issues, and addiction, of course. But there are, of course, some challenges despite the existence of such a framework. And these numerous challenges may include, for instance, insufficient resources, as also detailed on this slide. But broadly speaking, again, insufficient resources, limited capacity, regulatory barriers, and divergent national priorities may be some of them. So overcoming these obstacles, of course, is essential to achieving the goals outlined in the international drug agreements. And of course, as we all know, in CND Resolution 66-1, entitled Preparations for the Midterm Review to be held during the 67th session of the CND in 2024, the Commission decided to focus the midterm reviews of this year in this session on taking stock of the implementation of all existing international drug policy commitments, and the work to accelerate the implementation of the commitments from 2024 to 2029, so the second phase, so to say. In this regard, as I said, 11 or 12 challenges were identified in the 2019 Ministerial Declaration. And of course, partnerships in this regard play a pivotal role in addressing the challenges associated with implementing these commitments by bringing together various stakeholders, again, including government, civil society organizations, sometimes the private sector and international agencies. As relevant, partnerships can pool resources, expertise, and influence to tackle drug-related issues more effectively, of course. And partnerships for drug control efforts may take various forms, of course, and these may be combined as well, including public-private partnerships, for instance, which may involve collaborations between government agencies and private sector entities, international cooperation initiatives, which basically means facilitating coordination among countries to address mostly, but other issues as well, but mostly cross-border drug trafficking and related challenges, and civil society collaborations, of course, which I'm going to talk more about today, which basically signifies engaging non-governmental organizations like the Turkish Green Crescent Society and community groups, for instance, in prevention, treatment, and rehabilitation efforts. And of course, as mentioned, the SDGs, there are also the SDGs that provide the even broader framework, and it's mostly the partnerships are related to the SDG number 17, partnerships for the goals. And as we see here, it's also about strengthening the means of implementation and revitalizing the global partnership for sustainable development. And of course, sustainable development cannot be thought separately from like the distinct goals, and especially SDG 3 here. So onto the role of the Turkish Green Crescent Society. Of course, as an NGO, as a civil society organization, the Turkish Green Crescent Society plays also a vital role in promoting partnerships for drug control, both at the national and international levels and community levels. So as a civil society organization in Turkey, again, the society is committed to prevention, counseling, rehabilitation, and advocacy efforts, mainly related to substance abuse and addiction. And just to give a few examples, of course, this is not, I mean, the examples I list here are just a few of them. There are many other examples, but because of time limitations, for instance, Istanbul Initiative, as Mr. Abiola has also mentioned briefly, is one of the examples of such partnership. Istanbul Initiative, just as a reminder, it emerged as a global action force, let's say, where divergent international civil society actors gather. And when they gather, they sit on a table and try and determine global strategies to contribute to public health and to prevent addictions. And the annual summits it holds with its members contain civil society actors from all around the world. And there are other like recap summits, etc. as well. And about the opportunities for collaboration, which I hope will be an output of this side event and of this CND session as well. So there are, of course, numerous opportunities for collaboration between civil society actors, as I said, and other types of partnerships as well. So, for instance, the Turkish Green Crescent Society and other stakeholders, the collaboration between other stakeholders with the Turkish Green Crescent Society, let's say, as an example, again, these may include partnering with government agencies to implement evidence-based prevention programs, which we have a few programs about collaborating with international organizations, of course, to strengthen capacity building initiatives, and engaging with the private sector to support corporate social responsibility efforts in addressing substance abuse issues. And one example here that I'd like to talk about, and as I said, these may be like combined and be like different models as well, which is the Green Crescent Addiction Prevention Training Program, or TBM in short, with its Turkish name. So this program, the Green Crescent Addiction Prevention Training Program, is a society-based global training program model developed by the Green Crescent. And the aim of the program is to increase awareness throughout society particularly on children and teenagers regarding various addictions, and prevent addictions by informing this target group with healthy living practices. And the program is realized by Green Crescent together with the Turkish Ministry of Education. So this is the partnership part of it. And the output is 10 million students and 3 million adults that have been achieved, that have been reached up to this day through 33,000 school counselors. And to conclude, I'm about to end my presentation. Let me talk a little bit about the way forward in a way, and give a few recommendations for enhancing partnerships. To enhance partnerships for the effective implementation of international drug commitments, it is of course essential to foster dialogue and communication among stakeholders, such as in the side event and in other events, sharing best practices and lessons learned from successful partnerships, increasing funding and resources, which is also important for collaborative initiatives, and ensuring accountability and transparency in partnership activities, of course. And in conclusion, again, partnerships, we all know, they're dispensable for effectively implementing international drug commitments and addressing the complex challenges posed by drug trafficking and substance abuse. So it's the whole, holistic thing in a way, and we need to also work in such a way together across sectors and borders so that we can make significant progress towards achieving our shared goal of a drug-free world and of sustainable development. And with that, I'd like to conclude my presentation. Thank you very much for your attention.
Yeah, you're just on time. Thank you, Zeynep, for that very brilliant and eloquent presentation. In order not to waste more time, let's invite the next presenter. Is he around? Giovanna.
I'm here.
All right, please. You have the floor. Sorry, I hope I have called your name very well.
Yes, you did. Thank you so much.
Okay, you're welcome. Yeah.
Thank you so much, Dr. Audi, and great to be here with you and the colleagues from the Green Crescent Network, and Matej, of course. And And thank you for being such a considerate chair. I count on you because you know me, I tend to speak. So let me share my screen, show all windows. This might take me a little while. Now I'm sharing my calendar for reasons that I don't understand. I try again. Share screen. Here's my presentation. I actually have very few slides, and I would like to thank my dear previous panelists, because they did all of the hard work of presenting the drug use situation and also the main commitments here, and some very good example of opportunities for action and collaboration. So this is what I had come up when I had been asked, you know, can you talk about partnerships? And I thought, what are, for me, the most important priorities and opportunities for action, collaboration, and reflection? And I will not, you know, elaborate here about the importance of having everybody on board: the governments, the international organization, the regional organization, the civil society, the research universities and academic institutions, and of course the private sectors. I think that that is a given. But what do we want to do with these partnerships? And this is very good that this event is at the end of CND, because this also is some thoughts that have come up to me while discussing with different stakeholders during this past week. And so let me start with these two together, the need to really invest in the coverage and evidence-based services. And by services, I mean, of course, prevention and treatment. And you know that according to the standards on treatment, treatment covers all of the services that are needed to protect and promote the health of people who use drugs and people with drug use disorder. And this goes from harm reduction to recovery and everything in between. So I'm really talking about everything. And the coverage of evidence-based prevention and treatment is abysmal. And I cannot help thinking that all of these crises that people are talking about and have been talking about in the Commission for the last week, the synthetic crisis, the fact that overdose rates are persistent and rising, the fact that now that the de facto government in Afghanistan has enforced the ban of opium cultivation, of course, we fear a swing to more harmful synthetics, as the use of more harmful synthetic substances, new psychoactive substances, polydrug use. All of these crises would have been much less urgent and terrible and tragic had we all invested more in evidence-based prevention and treatment and services. I really cannot help thinking about this. And so it becomes more urgent than ever. Then instead of squabbling, we really pull together and start implementing more prevention, more treatment and care and harm reduction that is evidence-based. So of course I put on the slide our standards, which are our reference of what is evidence-based, but I've also put here scale up, because of course, you know, the scientific evidence also has gaps. And for example, we don't have yet scalable intervention, easy to use intervention for the treatment and care of stimulant use disorders like we have for opioids. And we need more research there. And that is an initiative that we have launched at this CND because we think there is a humongous gap that needs to be filled. Now, the other thing is that, yes, coverage and evidence-based services are absolutely key and priority. The other thing is that we need to stop thinking about one service here, one program there, and so on, and really start developing systems. And on treatment here, the standards are based on a public health model of delivering services, and the standards provides you with the complete description of a system. And we have been working with many countries to build that, and we need to do more, of course, but we are already in that space. With prevention, we have started this this year by launching CHAMPS, Children Amplified Prevention Services. It's an initiative to try and develop a complete system of prevention for children, so persons under 18, according to the Convention on the Rights of the Child, from birth to adolescence, and really ensure that their development is protected and flourishes and is healthy and safe throughout. And so watch this space, and I'm really hoping that this will be a huge opportunity. I mean, both these will be huge opportunities and priorities for partnerships. Another thing that is absolutely key is the partnership and the collaboration between the health and the law enforcement and the criminal justice sector to make sure that services are offered as alternatives to conviction or punishment for people in contact with the criminal justice system, and the services are available in prison settings. And this is for many good reasons. One, this population is more vulnerable health-wise, has more problems of drug use and of mental health disorders. B, punitive policies have been found to be not effective, counterproductive, and against human rights. And we have some really good tools that we can apply in this space to make sure that people who use drugs and people with drug use disorder are provided the support that they need, and therefore they recover, and this leads to also less crime and less prison overcrowding. And it's a huge untapped opportunity for partnerships. Two more things that I'm thinking, and here I don't have a good picture because this is something where, you know, we are developing our thoughts, and I would very much welcome your contribution. The first one is the issue of private sector. As Zeynep already mentioned, their amazing collaboration to make sure that that we tap into corporate social responsibility. But I also want to think that we need to start working on what the WHO has presented since a couple of years, meaning the commercial determinants of health, and the commercial determinants of health that are at play in our space. In our space, if you think about substance use and substance use disorders, I can think about commercial determinants of health related to the tobacco industry, to the alcohol industry, increasingly with the cannabis industry. Of course, the pharmaceutical industry pressure for overprescription has led to a crisis that we are still paying. And guess who is paying? Especially low and middle income countries who do not have access to controlled medicines, especially for the management of pain, because authorities are too scared to address this gap because they are afraid of developing another crisis. And for me, it's really important to say that a balance is completely possible, that we can be vigilant to the commercial determinants of health in all of these spaces and promote better practice, harnessing and not being used by the power of the private sector. And a specific space of the private sector that we need to pull together and work more on is the digital sphere. And there is a lot of talk about opportunities in the digital sphere, especially with regard to delivering services in a way that is cheaper. My question is it really cheaper and is it effective? I was in a forum of WHO on mental health last year, and they presented, that there are more than 10,000 globally apps to promote mental health, and none of them is really evaluated. So what are we exposing our vulnerable population to? We need evaluation, and we can do evaluation if we pull together. And we need it fast, because this is an opportunity. We just need to use it properly. And the other connection that we need to make is, of course, about all of the use of social media and what the connection to mental health, especially of children, but not only. And we need more work there. And we will need very strong partnerships to make sure that we emphasize the opportunities for social media to be how can I say, fostering the healthy and safe development of children, especially children that are more isolated, maybe disabled, and so on. And that we minimize the effect that the use of digital spaces, particularly social media, can have on the mental health of children and adults. And I think I will stop here, and I want to thank you for this great opportunity to share some of my reflections, and I'm looking forward to working together to really build on this. Thank you so much.
Thank you so much, my sister. Your presentation is so inviting, and I couldn't just help to allow you a few minute extension. It's quite impressive, and I hope we all learned. I will want to call the last person, if he's with us. Matej?
Yes.
See around? Yeah, please. You have the floor, so that we give the remaining space for question and answer session. So please, you can go ahead to your presentation, please.
Okay, thank you very much. Do you see my presentation?
Yes.
Yes. Okay, good. I hope the slides will move. We are now very familiar with Zoom already, so I hope there won't be any disturbances. So I'm very sorry to be late at your event, but I was a speaker at another event, same time slot. I apologize there, so I'm able to be here with you in one of the rooms here in the Vienna International Center. Yeah,
you're welcome.
Yes, please.
So you're welcome. You're welcome.
Okay, thank you. So I was asked to present here some good example of collaboration between government and NGO, because despite this week I'm switching a lot between two of my roles. One role as a VNGOC chair and also as a director of UTRIP. So now I'm speaking as a director of UTRIP. I would like to present one very good example of collaboration between my organization and Slovenian government. And this CND resolution on early prevention from 2022 was, I think, a very good example how NGOs and governments could collaborate together in this implementation of international commitments. And despite the fact that prevention specifically is not mentioned as a challenge in 2019 Ministerial Declaration, there is a lot of going on, a lot of discussions, a lot of consultations also related to prevention. So I would say that this resolution was part of the international implementation of international commitments, despite the fact that it's not corresponding challenge in the Ministerial Declaration. So let me start with the whole background of this idea, because my institution worked in the field of prevention for more than 15 years already, and most of the time we were entering this this space very late during the adolescence, where there is already a fire going on, and we felt like firefighters all the time, responding to emerging situations. Schools were calling already with the desperate situations in the schools, and expecting from us a recipe how to solve these issues overnight. So we then finally found out that this is not the way to go further in the future, and that we have to do something more before the adolescence. And we were trying to search in the literature what is available, what is going on, if there is any scientific base for early intervention, early prevention interventions, because as you all know, that most of our organizations, especially civil society organizations, are present in this emerging developmental period, which is adolescence, and there is not very much going on before adolescence, and also in early adulthood there is a huge gap in implementation of evidence-based practices. So we searched in the literature, and we actually found that there is already a concept of early prevention. There are definitions about early prevention, maybe not specifically related to substance use, but our colleague from Cambridge University, David Farrington, and his team, they developed this concept very early, a long time ago, more than 20 years ago, in the context of antisocial behavior and crime prevention, which is not far away from substance use prevention, especially not in early periods, because in early developmental periods, we're actually not even discussing about substances, not even discussing about so much about violence and all these extreme outcomes of risky behaviors. But the concept actually exists, and we were able to take this knowledge and take this already a theoretical background, all these different definitions, to scale up to more political actions and advocacy in this field. And we also know from many resources, also this is very famous study published in Lancet before COVID times, about how much money we could save if we would invest in early prevention activities to prevent adverse childhood experiences. This now in 2024, ACE, adverse childhood experiences, is a hot topic, is an emerging issue. But at that time, before COVID, we were starting to explore a little bit more about this this specific area of work, and it's really clear that if we invest early in developmental stages, early in children, even not children, but in future parents, we could save a lot of money. And if evidence is not enough for governments, maybe money could speak better for policymakers. So this is really, we have a lot of good arguments to advocate for investment in early prevention. And we have standards, international prevention standards. As you can see, there is a lot, offer is there, a lot of available interventions for these early developmental stages. So we are not starting from the scratch. So we have interventions available for these early developmental periods. Who wants to invest? There are already opportunities for investment. And luckily, you know, in prevention, you always have to wait for windows of opportunities. So a Slovenian presidency to the EU was this window of opportunity for also for us as an NGO to interact more with our government, because government actually came to us and asked us what we think would be a topic in the field of prevention they should put on the agenda for the Slovenian presidency in the field of drug policy. And we were really clear after, you know, searching for these arguments and preparing this idea about the concept of early prevention. This was, I would say, a next step to put this topic on the political agenda. And the whole Slovenian presidency in the field of drug policy was about early prevention, was about social and emotional learning as a systemic prevention approach, not only as a one or set of interventions. So this was a starting point. And there was a challenge, of course, for Slovenian government, what to do with this. Is it only a topic for a half of the year of discussions, or we should do something more? So we came to the conclusion that there is excellent opportunity to finish this Slovenian presidency with a draft resolution for the CND. And the idea was to file a resolution on early prevention. This was a natural step forward in this process. And we made it. Actually, government and Slovenian mission in Vienna accepted this challenge. They processed this in an excellent way in collaboration with UNODC, thanks to Giovanna's team as well. They contributed a lot in this process, also in advocating among member states for this idea, because as you can imagine, in Vienna, this discussion about social and emotional learning, parenting skills, and so on, this is weird in the halls of Vienna International Center. People are used to speak about drug trafficking, seizures of drug, and on and on, but not so much about, if they speak about prevention, it's always in the context of, very late, already time for, going to the treatment centers and so on. But it was really weird for some member states to hear or to discuss about, and that was maybe a lucky circumstance, because if people don't know what is in the discussion, they're rather silent and they support without saying anything silly if they don't know what is the main topic. Maybe just as a joke a little bit. So probably it was a lucky circumstance also, because people were not really aware what we are talking about. And usually prevention is not controversial issue at all. And there was not in many cases, in many resolutions, it's not so much happening. It's always a resolution, some commitments, and so on. But this resolution is really scaling up. Last year, it was a conference paper. UNODC prepared this paper about better explanation of what is early prevention. What are the principles? What are the potential best practices in this area, to explain a little bit more to member states, UN agencies, and also to civil society organizations what is all about in the field of early prevention. And the final slide, and I will conclude with this. This is even further scaling up. So, Executive Director just announced this year a campaign initiative which is called CHAMPS, and this is a next level of this resolution. So there are commitments, there are intentions and serious considerations how we can invest more, how we can promote and advocate for better interventions in the field of early prevention. So I will stop with this, and I'm pretty sure that this will scaling up even more and more every year, and civil society organizations will definitely give our inputs and contributions also in the future. Thank you very much.
Thank you very much, my brother, for that yet another brilliant presentation. For every $1 spent in early prevention, will save further dollar in treatment. When it was 50 minutes, I don't know whether we can use the remaining 2 minutes to one or two questions, since there are members of the audience that have joined and they may have 1 or 2 concerns. If we can give them that opportunity so that we can use up the whole time. Thank you. The floor is open. It's not in no particular order. Anybody who have any concerns to raise among all the presentations, undoubtedly the presentations have been quite lucid, and I'm sure even if I use it this way, even a fool will understand. You've all done justice to your topics, but the floor is open, 1 or 2 minutes, so that we can hear your concerns. Members of the audience, please.
Can I ask?
Yeah. Yeah. Our brother from Morocco. Good morning. How are you, sir? Dr. Musa. Yeah.
Yes. This is Dr. Musa, President of the Jordan Anti-Drug Society, and I would like to give a question to Madame Campella. Madam Campella, considering the pressing needs for mental health and addiction treatments in Palestine, amid the ongoing challenges, how can a partnership be effectively leveraged in the Middle East to address these critical gaps in care and support?
Yep. Yes.
I think that what we need to do is very similar in reality to what we need to do in all regions. And I will be maybe a bit simplistic and at the same time provocative and say we just need to put our egos aside and start working together. There are too many divisions among people who provide services. I'm not talking specifically for services for people who use drugs and people with drug use disorder, but believe me, the issues are very similar on prevention. But I'm thinking about now the urgency of addressing the needs of people who use drugs and people with drug use disorders. And these services are divided. They are not of good quality always. People are defensive when there is talk about moving from certain evidence-based non-evidence-based practice to better evidence-based practice or improving the quality. And I think that given the untapped need, there is space for everyone. We just need to pull together and really start using the science that we have and prioritize the evidence-based services for that have good quality. And in this, I think that sometimes, how can I put it? Even speaking from my own organization, we get locked into institutional struggles. And I really count on civil society and the richness of civil society that includes people who use, people in recovery, families of affected populations, youth communities, all of these, please to pull together and push for action that is of high quality and based on high evidence. And I know that I'm not saying anything new. I know that if this was, this is easier said than done, because if it was so easy, we wouldn't be here, right? But in the end, that's the only thing that's going to work. And I take courage from the fact that in many countries, including the region where you're asking about, there are good examples of partnership. We just need to build on that. So sorry for the generic answer. It would be difficult to really get into specifics in little time, but I'm really, really happy to connect and maybe discuss specific opportunities, maybe in a country or in a town, whatever it is in practice. You know where to find me, but I will put my email in the chat just in case.
Thank you so much.
Thank you very much. Like I said, I don't know whether we have time to take one person or we just round up. The organizers.
A couple of minutes more. I don't know. I'm not the organizer. Sorry.
No problem, because it's.
No. Unfortunately, we should close it. Should close the session.
Questions who are concerns.
Dr. Audi, we should close the session. Yeah.
All right. So thank you very much on behalf of the organizers. Says we should close, and want to thank each and every one of you for making our time to grace this occasion. It's been quite a very good time together. See you on the next sessions, inshallah, when we'll take more on this. So on behalf of the Green Crescent Health Development Initiative, Nigeria, I want to thank each and every one of you for making our time. Thank you. Have a blessed day.
Thank you.
Thank
Yeah.
you.
Thank you.
Yeah,
Thank
bye-bye.
you all our panelists. Very grateful
Thank you.
to all of you. Thank you.
Thank you. Yep.